afternoon everyone. I am Dr. Rashmi Chaudhary, the Senior Obstetrician and Gynaecologist in Cloudnine Hospital, Bellandur, Bangalore. I have a working experience of more than 26 years in the field of obstetrics and gynecology. My area of specialization is the management of high-risk pregnancy and the complicated gynec surgeries. Cervical cerclage, or in common words, the cervical stitch in pregnancy, is basically a procedure where we put a non-absorbable suture at the level of the internal os in the cervix. To understand this, we have to understand the basic anatomy of the uterus. Uterus is basically divided into an upper part and a lower part. The upper part is the body of the uterus where baby remains, and the lower part is the cervix, and the normal cervical length is about 3 to 4 centimeter. The bare minimum is about 2.8, which is pregnancy. Otherwise, it can lead to a preterm delivery. So basically, cervical cerclage is done to prevent a preterm delivery. 14 to 16 weeks, 13, 14 weeks, 16 weeks of pregnancy, or sometimes we do it in the later part like 20, 28 weeks, depending upon the ultrasound findings. Why we do? We do to prevent the preterm loss. So who are at a risk of having, and which women are more prone? So there are some group of women who have a weak cervix or an incompetent cervix, in common words we call, where the cervix is weak, unable to hold the pregnancy up to the term or 37 weeks. Sometimes women undergo several procedures in the cervix like repeated dilatation and curettage, or they have undergone miscarriages, and because of that we need to dilate the cervix to complete the procedure. A female can undergo some cervical biopsy, cone biopsy, which can also further damage their cervix, and sometimes it is weak on its own. So in these type of cases, as we anticipate the condition, we see the cervix length. Once we are done with the NT scan and double marker, we see that cervix is found to be short, or there are some women who have a multiple pregnancy or a very high risk pregnancy and cervix is short. There we go for the cervical cerclage procedure. So basically it is done under anesthesia. We admit the patient and we do it under anesthesia. So remove that myth from your mind that it is a painful procedure. It is not at all. We do it under anesthesia. You will not understand the procedure thing. And it can be done in different ways, like it can be done through the vaginal route, it can be done through the abdominal, also by laparoscopic methods. So what you should take after the cervical cerclage procedure? Basically, you should take absolute 2 to 3 weeks of rest after the procedure, rest in the left lateral as well as in the head low position to minimize the pressure on the cervix. You should avoid any strenuous physical activity. Intercourse should be avoided, and any infection, repeated urinary infection or vaginal infection, should be avoided with the appropriate measures, like you should increase your water intake, personal hygiene should be maintained, or if any infection, it should be treated at the earliest. You should also avoid constipation by using the enough amount of water, 2 to 3 liters of water, rough phase fruits and fibers. You should take care in cerclage procedure. Basically, you should take care that if there is any high fever, temperature more than 100 degrees Fahrenheit, if there is a repeated vaginal greenish yellowish discharges coming out, you should rush back to your gynecologist. And if there is any bleeding or intermittent uterine contractions like pain in the lower abdomen you are feeling coming and going, or severe menstrual cramp, you should report back to the doctor. The appropriate measures will be taken.